people get anxious to get their COVID-19 vaccines, more services are offering wait lists for those hoping to get extra doses at the end of the day. KCRA3's Brandy Cummings joins us live now with the details and also the concerns that a Sacramento doctor has about this. Brandy?
Yeah, Brian, so there was a website recently launched called Dr. B. It says its mission is to make access to the COVID-19 vaccine more efficient and more equitable. But KCRA found out today that UC Davis says it has its own standby list that is populated with eligible people who can be at their location in 30 minutes. We also found out from a Kaiser spokesperson, it sent us a statement. They said in part, quote, "We have an extremely low cancellation rate and generally cancellations are filled pretty quickly, even on the same day. We monitor our doses closely and can call in members who are booked the next day or later to come in early." Also, Mercy Medical Group says they have their own standby list as well. When they host a vaccine clinic, staff actually contacts patients of a certain age, ethnicity, and within a certain zip code to offer vaccines should they have any left over. I also spoke to the chair of the Mercy Family Medicine Department, or the Family Medicine Department there at Mercy Hospital. She says these websites that are offering wait lists actually put vulnerable communities at a disadvantage.
Unfortunately, this also caters to a patient demographic that does actually have more access. So more ability. So the ability to just take off from work immediately, or if you're already working from home, having that opportunity to work from home and be able to just kind of go immediately, to be able to receive a text message and sign up online. Having internet access is really an advantage.
I also talked to Dr. Roberts today about how people are even getting the vaccines. She says that tier system that we hear so much about, that system that's right now based on age and even job description, it causes inequality, according to her. She says because it's not 100% effective in targeting the most vulnerable populations.
When you actually look at the data for the folks that actually died from COVID, it's not necessarily by age. So age is a factor, but we know that patients that live in a community where the median income is less than 41,000 have a death rate that's 38% higher than the statewide death rate.
And so Dr. Roberts says to try to address that inequality, Sacramento County is actually hosting several pop-up clinics in some vulnerable communities and trying to help people that may not have internet access be able to sign up and ultimately get vaccinated. Now, Brian, Lisa, of course, it's important to note that website that we mentioned, that Dr. B website, is not yet live in California. So although people can go to the website and sign up to one day perhaps be able to get on a wait list, that is not yet happening in our area. Back to you.